Today's session. I hope you're all doing well. So we're going to continue with the female reproductive system. And today we're going to look at the menstrual cycle. So today we're going to look at the menstrual cycle. So we all know, I'm sure every one of us has heard of the menstrual cycle, the monthly bleeding that most females go through, okay? So at puberty, the female begins to undergo regular menstrual cycles controlled by the hypothalamus. The hypothalamus is part of the brain, okay? Part of the brain. So that is the part that controls endocrine secretions, and therefore it also controls the endocrine glands of reproduction. So the menstrual cycles are controlled by the hypothalamus. Now, the hypothalamus secretes gonadotropin releasing hormone. Remember, the hypothalamus releasing hormones. The releasing hormones are the ones that work on the pituitary gland, the anterior pituitary gland, to go and have effect on other glands of the body. All right. So the releasing hormones will come from the hypothalamus. So in this case, we have gonadotropin releasing hormone. This gonadotropin releasing hormone will have an effect on the anterior pituitary gland, and then the anterior pituitary gland is going to release gonadotropins. All right. It is going to release gonadotropins. In this case, the specific gonadotropins that we're talking about are luteinizing hormone and follicle stimulating hormone. All right. So these are the gonadotropins that we're talking about that control menstruation, okay? That control menstruation, or rather, that control the menstrual cycle, okay? So we're saying that these gonadotropins control the cyclic changes in the ovary, okay? They control the cyclic changes in the ovary. The gonadotropins will control the cyclic changes in the ovary, not in the uterus, in the ovary, okay? Now, the menstrual cycle is divided into two. We have an ovarian cycle and a uterine cycle. This is because we have two different things happening at the same time consecutively. You are going to find things happening in the ovary. At the same time, you're going to find things happening in the uterus, okay? In the uterus and in the ovary. And so therefore, this cycle, the menstrual cycle, is divided into an ovarian cycle and a uterine cycle, okay? So that is how that is supposed to be arranged. Now, just a brief introduction to this whole thing. We have to understand that the female does not undergo menstruation before they reach puberty, okay? So menstruation starts after they reach puberty, and that is normally between 12 to 16 years, with the peak being between 12 and 14 years. So most females, by 12 to 14 years, they would have started their menses already, okay? That means they would have started menstruating. That means they would have started undergoing these menstrual cycles. All right. And then we have menopause, which occurs at between 45 and 50 years old. Menopause is a state where this female now stops menstruating, okay? They stop menstruating, they stop having those menstrual cycles. So that is what is called menopause, and it occurs between 45 and 50 years of age, okay? Now, menstruation itself, not the menstrual cycle. We are saying that menstruation is part of the menstrual cycle, and menstruation is the time where this female is bleeding, all right? So this one lasts 3 to 7 days every month, all right? It lasts 3 to 7 days every month. All right. The menstrual cycle itself, the cycle lasts approximately 28 days, but may range. Okay. Others may have a shorter menstrual cycle from 21 days up to the longest menstrual cycle being about 35 days. All right. The cycle. But the menstruation, meaning the bleeding, all right, is also has a range, and this range is between 3 to 7 days. So someone may bleed for 3 days, another person may bleed for 7 days. Both are said to be normal. Okay, the normal volume of blood loss should be about 30 to 35 mils, okay, every menstrual phase, at least 30 to 35 mils every menstrual phase. So we're saying each normal sized tampon or pad holds about a teaspoon of blood. That is about 5 mils. So if you're going to change pads at least 3 times a day, all right? So that you have at least by the end of 7 days, you would have bled or you would have lost about 35 mils of blood. Okay. And then we're saying that blood loss of more than 80 mils is said to be abnormal. All right. It is said to be abnormal. That is too much blood loss. So that is called menorrhagia. Menorrhagia is a situation where this woman loses more than the required amount of blood that should be lost. And that is about 80 or more mils of blood. Okay, that is what we are saying. All right, and then we are saying the normal menstrual period is not supposed to have any bleeding in the middle. For example, if a woman bleeds on the 1st, let's say on the 1st of October, and the next bleeding is supposed to start on the 28th of October, because remember we're saying that on average, the normal cycle is supposed to last 28 days. Therefore, if this woman bleeds on the 1st, she should expect her next bleeding to be on the 28th of October. Okay. However, if between the 1st and 28th October, so she bleeds from first to maybe to the 5th of October, and then again she starts bleeding on the 15th or on the 16th, that is not normal. So that is not normal, and therefore that is known as a metrorrhagia. So there should not be any intermenstrual bleeding. Intermenstrual bleeding is known as metrorrhagia. Okay. So now let us start looking at the two phases, or the way that the menstrual cycle is divided. Okay, the two types. So we're saying that first of all, we have the ovarian cycle, the two cycles. Of the two cycles, the ovarian cycle. So ovarian cycle happens within the ovary. Okay, it happens within the ovary, and this ovarian cycle is regulated by the gonadotropins that we have talked about, that are coming from the anterior pituitary gland. Okay, so the anterior pituitary gland is going to secrete the gonadotropins, and these are the ones that are going to regulate the ovarian cycle. The ovarian cycle is divided into 3 phases. We have 1, the follicular phase. Okay, we have 2, the ovulation phase. We have 3, the luteal phase. So these are the 3 phases that the ovarian cycle is divided into. So the first phase is the follicular phase. Okay, this is the phase in which, remember, we said earlier in the other sessions that we are going to have, during when we were doing gametogenesis, we did mention that there is supposed to be about 15 to 20 follicles that are recruited every month to start developing. Okay, that are recruited every month to start developing. So this is the phase that is known as the follicular phase. Now, that is why that is the key event in the follicular phase. The key event is the development of the oocytes. Because remember, we also said that of the 15 to 20 that will be recruited, only one will go to full maturity. The rest will undergo atresia and they will degenerate. Okay. However, we have only one that is supposed to reach full maturity. And that is why this is known as the follicular phase. Okay. Now we are saying that one follicle, remember from gametogenesis, one follicle consists of an oocyte. All right, so if you look at this one, this is a follicle, this is a follicle, this is a follicle. However, these three follicles are at different stages of development. So when they are recruited, they are at this stage. And then we are saying that an ovarian follicle consists of an oocyte, all right? If you look inside here, this is an oocyte with its nucleus, all right? And this oocyte is supposed to be surrounded by one or more layers of follicular cells. Remember these follicular cells, the flat cells that surround the oocyte. As these follicular cells start growing and changing shape from squamous to cuboidal, they are now known as granulosa cells. So these are all follicles, okay, at different stages of development. We're also saying that there is a basal lamina underlying these follicular cells. So for example, if you look at these cells, you're going to notice that there is going to be a basal lamina, a basement membrane, which is a basal lamina, which is part of a basement membrane, okay, underlying these follicular cells or these granulosa cells. And this is the one that separates the follicle from the underlying or the surrounding stroma. Okay, the follicles that are formed during fetal life, these are known as the primordial follicles, consist of a primary oocyte. So this is a primary oocyte enveloped by a single layer of flattened cells. Okay, these flattened cells are known as follicular cells. All right. Now, when these ovarian follicles start developing, okay, when they start growing or maturing, the hormone that is responsible for this is known as the follicle stimulating hormone, okay? And this follicle stimulating hormone is secreted by the anterior pituitary gland. Once there is follicle stimulating hormone, the follicles that are supposed to start developing will then start. So 15 to 20 follicles are recruited. Usually one follicle grows much more than others. Okay, like we said, others will enter atresia. Okay, so that is the follicular stage. And then we have the ovulation stage. The ovulation stage is simply where there is the rupture of the wall of this mature follicle, okay? And once this wall of the mature follicle ruptures, we're going to find that the oocyte is what? Liberated, meaning the oocyte is taken out of the follicle as well as out of the ovary. Okay, so we look at this one. This is the follicle also. This is a mature follicle. It has an antrum there that is a collection of fluid. Now, there are so many things that are happening here. The antrum is growing. There's going to be pressure. There is going to be release of certain hormones that are going to make this area that are going to make this area weak, and therefore this follicle is going to pop and is going to release this mature oocyte. Okay, so we are saying that ovulation takes place approximately on the 14th day of this 28-day cycle. So of the 28th at the 14th day of this 28-day cycle, we are going to notice that this person is going to have ovulation. That is the best time for someone to fall pregnant. Okay. In the human, only one oocyte is liberated. Okay, like we say. But sometimes there is no ovulation. Okay. Sometimes there is no ovulation. And when there's no ovulation, that is known as an anovulatory cycle. So you think, okay, because I did my menses, so I'm supposed to ovulate. Sometimes there is no ovulation. And other times, the person may ovulate two or more oocytes. And therefore, when there is copulation, when there is copulation, you find that this woman is therefore going to um, therefore conceive more than one fetus. Okay. The stimulus for ovulation is a surge of luteinizing hormone. Okay, there is a surge. There's an increased secretion of luteinizing hormone by the anterior pituitary gland. Okay, so this is in response to high levels of circulating estrogen. Now, remember we said the first thing that is going to happen is that follicle stimulating hormone is going to stimulate these follicles to start growing. And when they start growing, this one follicle is going to grow to be mature. As it is growing, it is going to produce estrogen, okay? It is going to be producing estrogen. All right. Now, when this estrogen is produced, it's going to be circulating in the blood, and this one is going to affect the anterior pituitary gland also, and it is going to cause the release of luteinizing hormone, an increased release of luteinizing hormone. Now, when there is this release of this luteinizing hormone, that is when there is going to be stimulation of ovulation. So when there is an increase in luteinizing hormone, there's an increase in blood flow through the ovary, and then plasma proteins will start leaking. Okay, and then this is going to cause edema at the point of the ovary. And this is going to result in an area of the wall of the follicle becoming weak. Okay, so this particular area here is likely to become weak because of degradation of collagen. All right, because of degradation of collagen. All right. So this is going to also result in ischemia of this area, and some of the cells here are going to die. Okay. Now, this weakness combined with an increased pressure of the follicular fluid, remember this fluid that is settling in here, and possibly the contraction of contractile muscles that surround. We said that we are going to have also contractile muscles around this follicle in the stroma. Okay. It leads to rupture of the outer follicular wall, and hence there's going to be ovulation. Okay. Now, if fertilization does not occur within 24 hours, this oocyte is going to die. It's going to degenerate. Okay. It means fertilization is supposed to occur within the first 24 hours of it being released. If not, it's going to degenerate. It's going to die. Okay. That is what that is. So the third phase under ovarian cycle is the luteal phase. The luteal phase is characterized by the production of progesterone. Okay, progesterone is uh, um, progesterone is produced by the corpus luteum. Remember, we are looking at this ovary here. This is a whole huge ovary. And then this ovary has these follicles that are developing. So at the beginning of the menstrual cycle, we have the group of follicles being being recruited to start growing. As they grow from primordial follicles to primary follicles, as they go into secondary follicles, okay? And then they go all the way and ovulation occurs. All right? And ovulation occurs. So we are saying that these are follicles. We are right to say this is the follicular. Okay, this is the follicular phase, and the follicles have been what? Been recruited to start growing. And then we are also right to say that this is the ovulatory phase, where now the mature oocyte has been ovulated. Now, once there is ovulation, there is going to be the remaining of these cells here that are going to become the corpus luteum. Now, the corpus luteum is going to produce estrogen. All right, it is going to produce estrogen. So this is what will characterize the luteal phase. Okay. After ovulation, these granulosa cells and the cells of the thicker interna of the ovulated follicle organize to come up with the corpus luteum. This is a very healthy corpus luteum. Okay, now the corpus luteum is likely to last 10 to 14 days if there is no fertilization. Unless it occurs. If there is fertilization, the corpus luteum is likely to last up to 4 months, all right? So it is going to produce progesterone, which is supposed to maintain the uterine endometrium, which has been developed, okay? Progesterone is supposed to maintain the uterine endometrium, which has been developed. However, if there is no fertilization, within 10 to 14 days, the corpus luteum will do what? Will die. They will degenerate by a process known as luteolysis, where there is programmed cell death. Okay, programmed cell death is known as apoptosis. One of the consequences of decreasing secretion of progesterone is menstruation. So you'll find that this woman will ovulate. So if the woman that we're talking about started her menses on the 1st of October, okay, it means that if their cycle is regular and is following the textbook cycle of 28 days, it means that by the 14th day, all right, by the 14th day, this woman should ovulate, and the corpus luteum should be strong from that 14th day going forward. Okay, so from that 14th day, more probably even the 15th day, if there is no fertilization, within 10 to 14 days, the corpus luteum is supposed to die. Once it dies, it means that there will be no progesterone. If there is no progesterone, that means there is no hormone to sustain the uterine endometrium, and therefore this woman will start bleeding on day 28, and therefore that the menses will now be seen. Unless this follicle that was ovulated is fertilized, then we'll find that this woman is going to now have this corpus luteum of pregnancy, okay, until about 4 months after fertilization, all right? So that is what happens. So after the corpus luteum degenerates, the concentration of blood steroids decreases and follicle-stimulating hormone is liberated again from the anterior pituitary gland. Therefore, again, another group of follicles is recruited. So again, we have another group of follicles recruited. Okay, the corpus luteum that lasts for only part of a menstrual cycle is called the corpus luteum of menstruation. Its cellular remnants are phagocytosed by macrophages. Okay, that is what we're saying. So if pregnancy occurs, the uterine mucosa cannot be allowed to shed. That is what we said already. Okay. However, if it does shed, then you're going to find that pregnancy will be lost. So you find that there are some people who may be undergoing miscarriages every now and again. So you may find that maybe their corpus luteum does not sustain pregnancy, meaning it does not produce enough estrogen to sustain pregnancy. And so you find that when this woman tries to fall pregnant, the fertilization is occurring quite well, but the corpus luteum is not producing enough progesterone. So you find that this woman will keep losing the babies. All right. So instead, a signal to the corpus luteum is given by a hormone called beta human chorionic gonadotrophic hormone. So now what we're saying is when a woman is pregnant, the normal thing that should happen is that as the embryo is developing, okay, there will be the production of a hormone known as the beta human chorionic gonadotrophic hormone. And this hormone is coming from those trophoblastic cells that we learned about, okay? The ones that later become the placenta. So we are saying that from the trophoblastic cells, we are going to find that there is going to be secretion. There is going to be secretion of a hormone known as beta human chorionic gonadotrophic hormone. And this one is the one that is going to sustain the livelihood of the corpus luteum. So when a woman is pregnant, the embryo, the fertilized or the fertilized oocyte, as it is growing, as it develops the trophoblastic cells, these trophoblastic cells are going to produce beta human gonadotrophic hormone. And this one is the one that is seen on urine tests. When someone is suspecting they're pregnant, they take a urine test. Most urine tests are going to detect the presence of beta human chorionic gonadotropin. And this is what makes people know that, oh, this woman is what? Is expecting. Therefore, when this happens, then this beta human gonadotropin hormone is going to sustain the corpus luteum, and the corpus luteum is going to continue producing the much needed progesterone to maintain the endometrium of the uterus. Okay. Now, this hormone, beta HCG, it one, rescues the corpus luteum from degeneration. We've talked about that. Two, it causes further growth of the corpus luteum. And three, it stimulates secretion of progesterone. Okay. In addition to maintaining the uterine mucosa, progesterone stimulates secretion of the uterine glands. So these uterine glands will start producing secretions that will be important for the nutrition of the embryo, okay? For the nutrition of the embryo, and this is before the placenta becomes functional, okay? So this corpus luteum that is found in pregnancy, that is bigger than the one that is found in a woman that is not pregnant, is known as the corpus luteum of pregnancy and lasts 4 to 5 months. Okay, when it degenerates, it is replaced by a corpus albicans. This corpus luteum, once it degenerates at about 5 months pregnant, it is replaced by the corpus albicans. So this is simply the summary of what we've already talked about. We are saying that we have, this arrow is coming from the hypothalamus. So the hypothalamus is going to produce gonadotropin releasing hormone, and this gonadotropin releasing hormone is going to affect the anterior pituitary gland. The anterior pituitary gland is going to produce gonadotropins, follicle stimulating hormone, and luteinizing hormone. These two will work towards the maturation of the oocyte as well as the ovulation. So we are saying that follicle stimulating hormone will cause the recruitment of the follicles to start maturing. As they mature, and as they mature by day 14, there should be a surge of luteinizing hormone in blood. There will be an increased amount of luteinizing hormone in the blood. And because of that, there is going to be ovulation at this point. Okay, as the days move on, the follicle that ovulated, the oocyte, will now start turning into the corpus luteum. It will start turning into the corpus luteum, but as days go by, within 10 to 14 days, if there is no fertilization, this corpus luteum will do what? Will degenerate and die. Okay, that is what we're talking about. So this is just a summary of what we've talked about in the ovarian cycle. Now, the endometrium. Remember the three layers of the uterus. We have the innermost being the endometrium. Okay, we have the one in the middle being the myometrium, made up of smooth muscle cells, very strong smooth muscle cells. And then we have the outer layer known as the perimetrium. So now, when we are talking about menstruation, we are really focusing on the endometrium. And this endometrium will undergo cyclic changes depending on the stage at which the menstrual cycle of this woman is. Okay, so we're saying the changes in the hypothalamo-pituitary ovarian axis, meaning hypothalamus, pituitary, and ovary. These are the ones that are involved in this axis. So these changes during the menstrual cycle, they occur whether or not this woman has a uterus. Okay, so whether or not this woman has a uterus, this woman will, all these will happen. That is why you find that even someone who does not have a uterus is able to have a child. Okay, they can be able to harvest their egg, all right, and put it in another woman, and they also use their husband's sperm, and therefore they have a child of their own. Okay, so menstruation, which occurs in the presence of the uterus, is the most obvious external manifestation that this woman is having regular menstrual cycles. Okay, as the corpus luteum dies at the end of the luteal phase, circulating levels of estrogen and progesterone fall. Okay, they fall precipitously. In an ovulatory cycle, where the endometrium is exposed to estrogen and then progesterone in an orderly manner, the endometrium becomes decidualized. Okay, so the endometrium will become, meaning it will start to grow, it will become thick. Okay, and this happens during the second half of the cycle. Okay, after the second half of the cycle happens after ovulation. So we're saying decidualization is an irreversible process, and if implantation does not occur, there will be apoptosis. Again, so meaning there will be programmed cell death, and there will be shedding of blood. Okay. So we're saying menstruation is the shedding of the dead endometrium and ceases as the endometrium regenerates. Menstruation is initiated by the withdrawal of estrogen and progesterone. After puberty, The ovarian hormones under the stimulus of the anterior lobe of the pituitary cause the endometrium to undergo cyclic structural modifications during the menstrual cycle. The duration of the menstrual cycle is variable, but average is 28 days. Because menstrual cycles are a consequence of ovarian modifications related to the production of oocytes, the female is fertile only during the years when she's having menstrual cycles. Okay? Now, this does not mean that when the person undergoes menopause, then they should stop having sex. No, they can continue. However, they just will not be fertile. Okay? So the beginning of the menstrual cycle is the day when menstrual bleeding appears. The menstrual discharge consists of degenerating endometrium mixed with blood from the ruptured vessels. So we are saying that every menstrual cycle begins on the day that this woman starts menstruating. So if this woman starts menstruating on the 1st of October, that is the beginning of their menstrual cycle. If this woman starts bleeding on the 5th of October, that is the beginning of the next menstrual cycle. So one menstrual cycle should last for about 28 days. So if this woman started bleeding on 1st of October, the next menstrual cycle should start on 28th of October, just like that, okay? So now we're saying the menstrual cycle or the uterine cycle has 3 phases. The uterine cycle has 3 phases, and these include menstrual phase, which lasts 3 to 7 days. It includes proliferative phase and includes secretory phase, also known as the luteal phase. Okay, so the secretory phase begins at ovulation and lasts about 14 days. So now, some literature will tell you that no matter how long or short your menstrual cycle is, the luteal phase is supposed to last 14 days approximately. Therefore, if your menstrual cycle is a 21-day cycle, so if you start if the normal if your normal bleeding cycle, if your normal cycle is you start bleeding on the 1st of October, and the next cycle is supposed to start on the 21st of October. That is a normal cycle, although it's a short one, it's very normal. That means that if you start bleeding on 1st, you finish on the 5th, okay? It means you are likely to conceive within the next 2 or 3 days after your menses finish. That means that you are likely to ovulate on the 7th day, because the remaining 14 days are supposed to be for the luteal phase. Okay, supposed to be for the luteal phase. So that means that if your menstrual cycle is short, you're likely to ovulate within the first few days before the ovulation or during ovulation. So immediately after your menstruation or even during menstruation, you're likely to ovulate. Okay, so that is what that means. Now, the first phase we're going to look at under the uterine phase is the proliferative phase. The proliferative phase is also known as the follicular phase, also known as estrogenic phase. Now, this marks the beginning of the proliferative phase coincides with the rapid growth of the ovarian follicles. So meaning it coincides with the follicular phase of the ovarian cycle. That is why it is also known as the follicular phase, okay? So it coincides with the maturation of the ovarian cycle. So this is when the thicker, those cells that are surrounding the follicle, the thicker interna, you're going to find that those ones are when they're the ones that produce this hormone known as estrogen. Now, the estrogen, the function of estrogen is going to go and work on the uterine endometrium, this inner lining of the uterus. So they go and work on the uterine endometrium and allows it to proliferate, where there is going to be a reconstruction, okay, of this endometrium. Now, this one is the phase that follows menstruation. During menstruation, this lining sheds off. So the next thing that should happen is the proliferative phase, where now there is now proliferation of the endometrial lining, and the endometrial lining is growing. This is caused by estrogen, which is produced or secreted by thicker internal cells of the growing follicles. Okay, so we're saying that the first thing that is going to happen is one, menstruation. However, once menstruation is finished, we're going to notice that there is going to be secretion, or there's going to be recruitment of the follicles from the ovary. Now, as these follicles are growing, remember, there was follicle stimulating hormone that was secreted to start the growth of the follicles. These follicles, as they are growing, there is going to be production of estrogen by the thicker internal cells of the follicle. And this estrogen is going to be the one that is going to cause the proliferation of the endometrium. That is why this the proliferative phase of the uterine cycle coincides with the follicular phase of the ovarian cycle. Okay, so we're saying that after the menstrual phase, which is usually about day 5 to 6 of the cycle, the uterine mucosa is relatively thin. So it's very thin, just about 0.5 millimeters thick. The remainder of the follicular phase is characterized by glandular and stromal growth. So these are there are glands in the uterus. Uterine glands will start growing. The stroma of the endometrium will start growing. And therefore, that is why it is known as the proliferative phase. Now, during this time, the epithelium lining the endometrial glands will change from simple columnar and will become pseudostratified columnar. All right, there will be a lot of growth of the cells. There will be a lot of increase in number of the cells. There will be a lot of mitosis, and so on and so forth. And so this one is going to grow such that at the end of the proliferative phase, it is going to be about 2 to 3 millimeters thick. It's going to be about 2 to 3 millimeters thick. So that is the follicular phase. And then we have a secretory phase. This one is also called luteal phase. Okay, luteal phase. All right, the post-ovulatory or luteal phase, which is also known as the secretory phase, is characterized by endometrial glandular secretory activity. Okay, this is where now the endometrium will continue becoming thicker. It will continue. The glands will start producing more secretions. Okay, now under the action of progesterone, estrogen-induced cellular proliferation is inhibited, and the depth of endometrium remains fixed. The depth of the endometrium remains fixed. So we are saying that under the action of progesterone and estrogen-induced proliferation is inhibited. There will not be a lot of proliferation anymore. However, there is going to be increased secretion. There will be increased production of collagen. Okay, so the endometrium, the depth will remain thick, but it will remain fixed, but it will continue becoming rich and rich, and it will become very tortuous. All the glands will become very tortuous. Okay, so like we are saying, despite this, some elements continue to grow, leading to increased tortuosity of both the glands, even the arteries, okay, that are supplying blood. This is in order to fit into the endometrial layer, because the endometrial layer is now thick, nicely, so now the glands have to now become tortuous. The spiral arteries have to become tortuous. It starts after ovulation, results from the action of progesterone secreted by the corpus luteum. That is what we mean by saying the progesterone maintains the endometrial layer of the uterus. Okay. So acting on glands already developed by the action of estrogen, progesterone further develops the gland cells. The epithelial cells begin to accumulate glycogen. Okay, the cells of the epithelium will start accumulating this nutrient, glycogen. One important feature of this phase is that the glands become highly coiled. So if you look at this, this is a diagram showing us a layer, these layers of the uterine wall, showing us these layers of the uterine wall. And so this is representing the myometrium, okay? This is representing the endometrium. Now, we said that the endometrium has two layers. We have this basal layer, which is closest to the myometrium, and then we have this functional layer. This is the layer that grows, okay? This is the layer that grows all the glands. So these are uterine glands, okay? These are uterine glands. These are spiral arteries, which are bringing blood to the endometrium. Okay, these are spiral arteries bringing blood to the endometrium. And then we have all these small capillaries, okay, that are supposed to also keep blood in the endometrium. All right, that is what we're saying. And then we have that epithelial layer, which is normally supposed to be simple columnar. However, when the endometrium starts growing, okay, when the endometrium starts proliferating, this layer is going to become pseudostratified columnar, and therefore all these glands will start, under the influence of progesterone, they'll start proliferating and becoming tortuous. All the blood vessels are going to become tortuous. There's going to be thickening of this layer of the endometrium. Okay? Now, the endometrium reaches its maximum thickness, which is 5 millimeters, as a result of accumulation of secretion and edema in the stroma. Okay? In this phase, we find that mitosis is rare, but there is increased production of there is increased accumulation of secretions, as well as there's going to be increased edema in the area. And so you find that this layer is going to continue growing. This picture here is just showing us the differences in the uterine glands throughout the cycle. Okay, so at the end of proliferative phase, we're going to find that we have this we're going to have these glands that are straight, they're not tortuous, okay? A lot of blood has been shed, and then we're going to find that in the beginning of the secretory phase, there's going to be, now the glands are going to start growing nicely, you know, with the influence of estrogen. There's going to be growth of glands. And then in the secretory phase, there is going to be, with the influence of progesterone now, we're going to have these glands that are going to grow more and more tortuous and thicker, all right? That is what that picture is trying to explain to us, okay? Now, if fertilization takes place, the embryo has been transported to the uterus, and there's going to be implantation within 7 or 8 days after ovulation. So from 14th day, 8 days later, you are likely to have implantation. So it is thought that the secretion of the glands is the major source of embryonic nutrition from the glands, because at this point, we do not have the placenta yet. Progesterone inhibits contractions of smooth muscle cells of the myometrium, okay? Now, because if the smooth muscle contractions are there, those pains that you feel during menstruation are due to the contractions of the smooth muscle. So if those ones start, this woman is likely to lose her pregnancy. However, with the presence of progesterone, those contractions are inhibited. Therefore, the patient, the woman will not lose her baby. Okay, the onset of menstruation means that there is now an ending of one cycle and the beginning of the next cycle.